Hello, our topic today is how long does it take to heal after a breast augmentation? Well, total healing is different than being able to get back to work. So let's talk about our protocol. Number one, the day of surgery is when you begin to heal. You'll be in the recovery room, we'll have ice on your breast, and we want you to continue with that ice on your breast. We've also injected your muscles in your breast with long-acting local numbing medicine. I strongly suggest, however, that you go ahead and use a non-narcotic pain pump. What is a non-narcotic pain pump? Well, this is one brand. There's several out there. Well, what is this? This reservoir is filled with non-narcotic marcaine, bubovacaine. It will gently drip in numbing medicine onto your pain nerves for the first 3 days. Well, how does that happen? Well, this sits in a fanny pack at your side. It's hooked here to the reservoir, and then this very thin catheter here is filled with little holes, like sprinklers that you might have, a soaker hose. What we do is we make a small little puncture wound in your armpit, about the size of a needle. We put this in and it lays right on your pain nerves. For the next 3 days, 24/7, it's dripping marcaine, like Novocaine, on your nerves. It's non-narcotic, so you can even drive with it on. I have patients going back to computer work the next day, or even going back to non-manual type work. Okay, so you'll get home. What do you have? I'll want you to go ahead and get 2 to 3 big bags of Costco size frozen peas or corn. Why? You'll put one in the freezer, you'll put it into a pillowcase and put it on your breast. I'll have you taking it easy that first day. We usually see you back the next day. At that time, we'll start the displacement exercises. And what are those? They're called massage. Based on your model photos, the size, the location, we know what you want to look like. You'll immediately look good in a bathing suit or a bra, but I want you to look good nude also. The natural action of putting the implants under the muscle pushes the implants up and out, and we want them down and in. Now, why is that? The muscle will push them that way. So we call it our 5-5-5. 5 minutes a day, 5 times a day for the first 5 weeks. More cleavage, you press the implants towards your center. If one sits too high, you press it down. One sits too low, you press it up. Both sit too high, we press it up and down. So now we call that seating or fluffing or post-op management. These are called displacement exercises. Once we get the implant to look the position that you want, then we'll put you into an underwire bra to quote-unquote lock them in. Remember, the bigger you go, the faster you fall. So, during this post-op healing, I like to have you in an underwire bra once they've seated or fluffed. And at nighttime, I don't think it makes any difference how you sleep or how you do that. Now, exercise. I let you go back to the gym as soon as you would like, with some caveats, as long as there's not swelling or pain. So, elliptical trainer, stationary bicycle for cardiovascular. Lower body you can do without worry. Upper body, use light weights. Go ahead. We call it walking the wall because the muscle stretches. You go on the wall and walk it up. Okay, the wounds should be healed in about 3 to 4 days. Oozing, stopping, etc., etc. It will feel lumpy and bumpy in the incision site. Why? We have internal sutures that last about 3 months to prevent wide scars. You'll be started on an anti-scar program using our silicone gels. That prevents a scar, whether it's around the nipple or under the breast crease. If we do an axillary approach, you'll have the silicone gel liquid that we'll have you put on. Sutures are out, you're back to normal activities. After 6 weeks, there's no restrictions. I like to have you wear a double sports bra, especially if you picked a larger breast implant. Why? The bigger you go, the faster you can fall. Boom, 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 boom. High impact, Zumba. So I call them locked and loaded. Double sports bras, they don't go up. We want to keep you up and perky. Most of the time, a good underwire bra. Now, you want to wear a backless dress, a halter top. Go braless occasionally, or wear a bathing suit. You've got to live, but we want to have good support for the breast. Now, you're healed. Now we go to maintenance, and I'm a firm believer in breast massage. Why? I want them breasts to be able to be displaced. Remember, the most common challenge we have is capsular contracture. So I have you 3 times a day, just take your breasts, go up and around like that in the morning, when you go to the bathroom, up and around like that, and at night, up and around like that. This does 2 things. 1, it displaces the implant, so it keeps the pocket open, so you don't get the hard breast. That's not because of the implant, but the scar tissue around it. Number 2, you'll know what your breast feels like. So if you start to notice one that feels harder or more firm, you hightail it into our office for laser treatments, ultrasound, medication. 90% of the time we can stop the process and not require surgery. So you're healed, enjoy, and thank you very much.